First muscle is the vastus lateralis. The origin is the greater trochanter. It comes down along the lateral side of the leg and attaches to the tibial tubercle via the patella and the patellar ligament. The action is knee extension. The next muscle is the vastus medialis. The origin is the medial portion of the linea aspera. It comes down the medial side of the leg and connects to the tibial tubercle via the patella and patellar ligament. The action is knee extension. The next muscle is the vastus intermedius. It is under the rectus femoris. Its origin is the lower one half of the linea aspera. It comes down under the rectus femoris and attaches to the tibial tubercle via the patella and patellar ligament. Its action is knee extension. Next muscle is the rectus femoris. The origin is the anterior inferior iliac spine. It comes down the medial part of the thigh and it attaches to the tibial tubercle via the patella tendon and the patellar ligament. Its action is knee extension and hip flexion. The next muscle is the semimembranosus. The origin is the ischial tuberosity. Comes down and its insertion is the posterior medial portion of the tibia's medial condyle. Its action is knee flexion, internal tibial rotation, hip extension, and hip internal rotation. The next muscle is the semitendinosus. Its origin again is the ischial tuberosity. Comes down and its insertion point is the medial portion of the tibial flare. The action is knee flexion, internal tibial rotation, hip extension, and hip internal rotation. Next muscle is the biceps femoris. The origin of the long head is ischial tuberosity, and the origin of the short head is the lateral lip of the linea aspera. The upper 2/3 of the supracondylar line. Insertion for both is the lateral fibular head and the lateral tibial condyle. Action is knee flexion, external tibial rotation, and the long head helps with hip extension and hip external rotation. Next muscle is the sartorius. The origin is the anterior superior iliac spine. It comes straight across. Its insertion point is the proximal portion of the anteromedial tibial flare. The action is knee flexion, internal tibial rotation, hip flexion, hip abduction, and hip external rotation. The next muscle is the gastrocnemius. The origin are the medial and lateral epicondyles of the femur. The insertion is the calcaneus via the Achilles tendon, and the action is plantar flexion and knee flexion. Manual muscle test for the quads is the same for all 4 parts of the quad. I'm going to have you extend your leg out to me, just straighten it out. Put my hand under here. I'm going to push down, don't let me break you. I'm going to hold it for 5 seconds. Ready? 1, 2, 3, 4, 5. Good, you can relax. The next manual muscle test is for the hamstrings. It is the same for all 3 parts of the hamstring. So I'm going to have you bend your leg up for me. I'm going to pull away from you. I need you to not let me break you. I'm going to hold it for 5 seconds. Are you ready? 1, 2, 3, 4, 5. Good, you can relax. The next manual muscle test is the gastrocnemius. Its action is plantar flexion and knee flexion. So I'm going to flex the knee. I'm going to plantar flex it. And I'm going to have you not let me break you. I'm going to be pushing down. I'm going to hold it for 5 seconds. Ready? 1, 2, 3, 4, 5. Okay, good. Relax. Next manual muscle test is for the sartorius. I like to say just tell the patient to look at the poop on the shoe. So I'm going to have you look at that. And I'm just going to pull away. Don't let me break you. I'm going to hold it for 5 seconds. Ready? 1, 2, 3, 4, 5. Good. Relax.